everyone and welcome back to my channel. Myself Dr.Surabhi Sahney from the Dr.Surabhi Sahney dental series and medical videos. Today I am gonna talk about a very important and a vast topic of anatomy. That is the thyroid gland. So without wasting time, let's get started with the topic thyroid gland. This topic is very important because definitely a long question will come on this topic in the subject of anatomy in first year of dentistry as well as for the MBBS. Talk about the thyroid gland. Thyroid gland is present in front of the neck. It is the largest endocrine gland which synthesizes two hormones, that is the T3 and T4, which is also known as the thyroxine and calcitonin. If we talk about the functions of the thyroid gland, then the first function is it regulates the basal metabolic rate. The second function is it stimulates the growth of the body. Third is it plays a very important role in the calcium metabolism. Now, if we talk about the special feature regarding this thyroid gland, that how it is different from other gland, then the thyroid gland is the first endocrine gland which synthesizes the hormone and then store them. It does not release the hormone directly into the blood. It synthesizes the hormone and then store the hormone and release in the blood whenever it is required. Or the second special feature of the thyroid gland is that it's the only endocrine gland which is present superficially, and that's why it is accessible for the physical assessment. It is the only endocrine gland which depend upon the external environment for the raw material. For example, it requires the iodine for the synthesis of the hormones. Last point regarding the special feature for the thyroid gland is that it is the only organ in the body which has the richest blood flow. If you want a proper notes regarding the thyroid gland, you can contact me by any of the mode. Either you can comment down your WhatsApp number in the comment section of this video. Along with that, you can also drop me the mail which is shown on your screen, and even you can DM me on my Instagram ID which is shown on your screen. I will definitely put the link of my Instagram ID in the description of this video. So don't forget to check out that, and you can have the PDF of the notes of this topic, that is the thyroid gland of anatomy. About the location of the thyroid gland, that the thyroid gland is located in the lower part of the front and the side of the neck, opposite to the C5, C6, C7 and T1 vertebrae. It is the H-shaped gland having the two lobes, that is the two lateral lobe, that is the right and the left lateral lobe, which are connected to each other by Estimas. Sometimes a small pyramidal lobe projects upward from the Estimas, and that is to the lateral to the midline, and it gets attached to the body of the hyoid bone by the fibromuscular band, and that is known as the levator glandulae thyroidei. Each lateral lobe of the thyroid gland extends up to the oblique line of the thyroid cartilage and below up to the 5th and 6th tracheal ring. Talk about the weight and the dimension of the thyroid gland, then the thyroid gland having the weight of 25 grams, and the dimension of the thyroid gland is 5 cm long, 2 cm thick and 3 cm wide. Thyroid gland is found to be larger in females, and it will also increase in females at the time of the menstruation as well as the pregnancy. If we talk about the dimension of the isthmus, then it is the 1.25 centimeter in both the directions, that is in the vertical and the transverse direction. If we talk about the capsule of the thyroid gland, then the thyroid gland is made up of the two capsules. The first one is the inner true capsule and the second one is the outer false capsule. If we talk about the true capsule, that is made up of the peripheral condensation of the fibrous stroma of the gland. Outer capsule is derived from the splitting of the pretracheal fascia. There is one feature that there is a thin posterior border present on the lateral lobe, and on the other hand it is the thick border present, or it is thick on the medial surface of the lateral lobe. As you know that the pretracheal fascia encloses the thyroid gland, which extend to the oblique line of the thyroid cartilage and will get attached to the body of the hyoid bone in the middle. On the medial surface of the thyroid lobe, it gets thickened to form the suspensory ligament of Berry, which connect the thyroid lobe to the cricoid cartilage. The dense venous plexus, unlike that of the prostate gland, it lies deep within the true capsule. In case of to avoid the hemorrhage, we need to remove the thyroid gland with the true capsule. Now the most important part of the thyroid gland topic, that is the relation of the thyroid lobe. We all know that the lobe of the thyroid gland is in the pyramidal in shape, and it possesses the apex, base, two borders and three surfaces. So begin with the apex part. Apex, it is directed upward and slightly lateral. It extends up to the oblique line of the thyroid cartilage. It is limited by the attachment of the sternothyroid muscle or the cartilage. If we talk about the apex is sandwiched between the inferior constrictor medially and the sternothyroid laterally, as you can well appreciate in the picture. Talk about the base, that the base is extend up to the 5th to 6th tracheal ring. It is mainly associated with the inferior thyroid artery and the recurrent laryngeal nerve. Here the nerve shows a very variable relationship with that of the artery. It either passes in front or besides the loop of the artery, or even between the division of the artery. Now begin with the surfaces of the loop. As we know, there are three surfaces of the loop. So first one is the medial surface, lateral surface and the posterolateral surface. Begin with the lateral surface, which is the convex and covered by the strap muscles, that is the sternohyoid, sternothyroid and the superior belly of omohyoid. Posterior border is covered by the sternocleidomastoid, which overlap inferiorly. If we talk about the second surface, that is the medial surface, then there are two tubes present, that is the trachea and oesophagus. Two cartilage is present, that is the cricoid and thyroid. Two muscles are present, that is the cricothyroid and inferior constrictor muscle. We talk about the third surface, that is the posterolateral surface. Then it is attached or associated with the carotid sheath, and its cancer cervicalis is embedded in the anterior wall of the sheath, while the cervical sympathetic chain lie posterior to the sheath, and it is present in front of the prevertebral fascia. If we talk about the borders, then there are two main borders. One is the anterior border, second is the posterior border. Anterior border is thin and it separates the superficial and medial surface. It is related to the anterior branch of the superior thyroid artery. Second border is the posterior border. Posterior border is thick and rounded. Posterior border is related to two things. One is the parathyroid gland and second is the longitudinal arterial anastomosis between the superior and inferior thyroid artery. If we talk about the last part, that is the relationship of the isthmus, as we know that it is connected toward the lower part of the thyroid gland, and that's why it has the relation that it has two borders. One is the anterior border, second is the posterior border. Posterior border is connected to the second, third and fourth tracheal ring. Anterior border is covered by two things. One is by the strap muscle, that is the sternohyoid or sternothyroid, and the second is it is connected to the anterior jugular vein. Now if we talk about the arterial supply of the thyroid gland, then there are four arteries are involved, that is the superior thyroid artery, inferior thyroid artery, accessory thyroid arteries and thyroidea. The venous drainage of the thyroid gland that include the superior, middle and inferior thyroid vein and thyroid vein of Kocher. That means there are four veins in the venous drainage. Then the lymphatic drainage of the thyroid gland. As we know, the part is drained in the pre-laryngeal and the upper deep cervical lymph node. The lower part will drain in the pre-tracheal and the deep cervical lymph nodes and the group of lymph nodes which follow the recurrent laryngeal nerve. As the upper lymphatics follow the pathway of superior thyroid artery, while the lower lymphatics follow the pathway of inferior thyroid artery. Now the last part is the nerve supply of the thyroid gland. The parasympathetic nerve supply is from the vagus and the recurrent laryngeal nerve. On the other hand, that's all about the complete video regarding the thyroid gland. If you still want the notes of the thyroid gland, you can contact me by any of the mode, either through my mail or you can DM me on my Instagram also. Along with that, in my next video, I will come with the applied aspect in detail in case of the thyroid gland. Till then, stay tuned, stay connected and don't forget to share and subscribe my videos. Thank you for watching.